Now time to continue on with part 2.
So now we get to the fun part of this lesson, which are the reproductive system infections. Okay, so now we're going to be talking about sexually transmitted infections, also known as sexually transmitted diseases or STDs. Now, unfortunately, this is another area where women tend to be more affected by these kinds of infections. The reasons are a little different from UTIs. So the reasons why women are more infected by STDs: first, the vaginal lining is a lot thinner and more delicate than the male penis lining and tissues. Okay, so the vaginal lining is thinner and more delicate. Secondly, and I'm sorry, students hate when I phrase it this way, but the female region is a lot moister than the skin of the penis. So if you think about it, the female area, there's high moisture and warmth, which is basically what microbes love. Think of an incubator. Think of when things spoil. It's usually moisture and heat. Now, unfortunately, the other issue that women end up having with STDs compared to males is that for women, they're less likely to notice or complain or go to a doctor with these symptoms, because for many women, if you feel discomfort down there, okay, you're so used to having menstrual issues every month that, a little pain, a little discomfort, you just kind of shrug it off. Whereas for men, the moment there is any pain or issue with their penis, I guarantee you they are going to call someone because they will freak out. Whereas women, it's kind of a common thing that they realize too late what's going on. Now, when we talk about STDs, they can be not just from bacteria, but they can be from any of the microbes. So bacteria, viruses, fungi, or parasites. And one of the biggest issues is that a lot of the STDs, especially in women, do not have signs or symptoms, especially in the earlier portion of infection. But unlike what most people think, you can get an STD from someone who is not showing any symptoms. For instance, you can get herpes from someone who does not have a mouth or genital sore obviously present. Okay, so people can be asymptomatic, and meaning they're not showing any symptoms, but you can still get an STD from them. And so the other big problem with STDs is that a lot of people don't realize that you can get them when you're in a monogamous relationship. Okay, so why can someone get an STD, or how can someone get an STD in a monogamous relationship? Well, one, even though you're with one person only at that time, well, one, everybody cheats and lies, but two, a lot of these infections, they stay with you for life. They go latent. So even though you and your partner may be honest and monogamous at this point, you may even be married, you do not know all of the partners they had in the past. They may have picked something up from those previous partners. They may be asymptomatic, and that virus or that infection is sitting in their body where they are able to transmit it to you. And one of the ELISA lab experiments we like to do with students shows that as well, where someone can be married, have children at this point, gets a call from an ex, and it turns out they have HIV. So these things can be very problematic. Now, yes, some of them can be treated with antibiotics or antivirals, but like I said, even with treatment, sometimes the treatment will kind of stop the current symptoms, but you are still stuck with a lot of them for life, and they can pop up later on down the line, and they're finding more and more causing issues down the line, including cancer that ends up killing people. So you wouldn't think that people die from STDs, but it's actually becoming some of the biggest cases of cancer and death are thanks to sexually transmitted infections. Now, the last point I want to make is, why are these sexually transmitted diseases so rampant and so difficult to control? And there are a few answers that I want you to remember. The first reason they're so rampant now is first of all, a lack of proper sex education. You know, a lot of the youth and even adults are not realizing that kissing, oral sex, fingering, and anal sex can all allow you to catch or spread STDs, meaning that giving or receiving any of these things, not just regular old penetrative sex, can cause STDs. One of the big ones that people don't realize, again, is oral sex. You know, for instance, giving or getting these kind of oral sex activities can end up causing infection. So a lot of people don't realize that. The way I always phrase it is, think of it this way. To a pathogen, a hole is a hole. So a pathogen will never look at a mouth, let's say during oral sex, and say, oh my God, that's a mouth, so disgusting, I will only go for a penis or a vagina. No, a hole is a hole, and both have, you know, the warmth and the moisture conditions that the bacteria or viruses love, okay, or fungi as well. So we'll talk more in detail in the later slides. One of the other reasons that the STDs are so rampant and problematic, I already mentioned the fact that not all people show symptoms. A lot of people will be asymptomatic when they spread the infection, so you won't even realize that you are picking up an infection. There's also the societal pressures, so the fact that we live in a hookup culture now of great access, so things like dating apps, social media, the internet, bars and clubs, all of that. You know, the world is a much smaller place now, and it's a lot easier to meet people. And along those lines, the increased density and mobility of the human population as well is part of the problem. Okay, so make sure you know some of the reasons why STDs are so rampant now and difficult to control. So now we're going to go through some of the examples of STDs. The first examples will be bacteria. So the first guy is quite famous, syphilis. This you used to hear of a lot more, but it does still exist, especially in certain groups. And with syphilis, first off, I want you to remember that it is caused by a spirochete. So treponema is an example of a spirochete, and it means it will be using axial filaments. Make sure to write axial filaments to embed itself in the person that it's infecting. Now, syphilis can either be through horizontal or vertical spread, which you're going to see for quite a few of the infections with STDs. Horizontal, like the horizontal mammo, is sex. So horizontal transmission is spread through sex, whereas vertical transmission, I always tell students, picture a pregnant woman standing up and boom, the baby just plops right out. Okay, so vertical spread is from mother to fetus, so it's transplacental. So make sure that you are very aware of horizontal versus vertical. And vertical is very sad because this transmission a lot of times will cause intrauterine death or birth defects, and basically, you know, if the baby does end up born, it may end up having a couple years down the line major facial or tooth deformities from the infection. The other sad thing about syphilis is that it has 3 stages. So the initial stages kind of may just look like nodules or even flu-like symptoms. Even in secondary syphilis, the secondary stage, that's when it's kind of like having the flu. But then the problem is it goes latent, and especially if it hasn't been treated, it goes latent and then pops back up, like a lot of things that go latent in the nervous system and neurologically. And so this is where you end up getting people back in the day, especially who had that syphilis psychosis, where it went to the brain and it just made them crazy. Okay, and the other thing I want to point out, syphilis, you'll see gummas whenever you hear that term or see that term. It's these horrible, horrible lesions across the body. Then we have the example of gonorrhea, and this is one of my favorite stories because most people hear gonorrhea as called the clap, and the reason why it has that nickname, there's a few different reasons. One is the normal, you know, kind of not sounding so bad, reason, which is that brothels back in the day used to be called clapiers, French term, and clapier then became, the idea most people were getting the infection from a brothel, so call it the clap. The other reason that always traumatizes the students, especially when we have boys in the class, is the clap also came from an old-time treatment where if you picture, a male would go in with this infection, and as you can see, there's, pus and discharge involved in this infection. And so the doctors used to think that, hey, maybe if we get that pus out, we'll free the person from infection. So what they used to do is take the male's penis, place it on, let's say, the desk or the medical table, and take something very solid and weighted, such as a textbook type of a medical book, and clap it against the penis to try and expel all of that pus and infection. Now, as you all know now, that does not actually work. It's an infection, it's bacterial, so antibiotics actually are the way to go. But unfortunately, they didn't have that back then, so they tried good old-fashioned clapping. Okay, so think of that anytime you say the word clap, or if you ever have to clap at a performance. Okay, now when we talk about the clap or gonorrhea, it's caused by a gram-negative coccus. So if you did a gram stain of it, what would it look like? Usually round and pink cells, and it's usually diplococcal, so you'll see two circles together. Now, like many of the infections, it does not survive well outside of the host, which is why it's a sexually transmitted disease, because it needs that close contact. The other thing with this is that it tends to be asymptomatic, especially in women. So a lot of times guys would catch this infection not knowing that the female was a carrier. And with this, just like with syphilis, transmission does not have to be from sex, which would be horizontal transmission. It can also be vertical. And this creates two big problems for women. And I want you to know both of these problems. The vertical transmission of gonorrhea causes, one, eye infections in babies. So when they're born, if you see them putting the eye drops, the antibiotic drops, that's, just in case the mom does have such an infection. And the other problem is, unfortunately, infertility issues. And you're going to see this in the next slide as well. So with this, when you think of gonorrhea, the idea is there are a lot of virulence factors. And so this is not only the pathogenicity, but that infertility issue is because of the damage done with some of the factors and the toxins and the damage to the epithelial cells in that body. Okay. Now, gonorrhea, when you look at the virulence factors, you'll notice that a lot of them are for adhesion, and that's important because if you're thinking of where this infection is, so for instance, penis or vagina, there's a lot of urine and discharge in those locations, so any infection there has to be able to resist getting washed away. So that's why there's a lot of adhesion factors, and there are also things that are kind of helping promote the rapid spread and kind of blocking the immune system from really being able to fight this kind of infection. The next infection I want to mention is one of the most common infections around, which is chlamydia. And with chlamydia, yes, you can treat it with antibiotics like doxy or azithromycin, but the big problem with chlamydia is the same issue we just mentioned with gonorrhea, that unfortunately, this is one of those things that can cause problems throughout life, especially for women. So you may be thinking that, oh, I'm young, I could do whatever I want, I'm young, I could, it's normal for me to go all these places, do all these things, not, really think about who or what I'm doing things with. and then not realize down the line that it can cause a problem. And the two big problems with this STD, again, are one, causing conjunctivitis in the babies if you are pregnant and have this infection. So during the birthing process, it ends up transferring to the baby as conjunctivitis or an eye infection. And the other thing is the idea of infertility, because this infection causes major scarring and tissue damage in that area that you won't notice. So yes, you may have treated it with an antibiotic and feel all better, but major scarring has occurred. And if you think about it, that then makes it harder for implantation of the egg and development of a fetus. Okay, and it's kind of funny because I tell the story about how I was watching the news with my grandmother, and you know, older people, the way they think or say things out loud, you know, old-fashioned thinking. It was a story on how much infertility there is nowadays, and how many women have to fight so hard and spend so much money and still at the end of the day not end up with the baby that they so badly want to have in their life. And my Nana just stops and looks at me and she goes, because all these girls, you know, it's all that sex before marriage. And the funny part is she didn't realize that in a way she was right, because of all the girls that and guys nowadays that are so careless with their sexual activities and don't think about the consequences. Because again, they think STDs all just take an antibiotic for that. Oh, everyone has them, it's no problem, doesn't really do anything. Well, it does do damage that you can't see, that's within your body and stays with you for life. And so a lot of these women unfortunately end up infertile because of the scarring and the damage that's been done inside their body, and they caught it from someone that didn't even have symptoms, so they didn't realize that they were walking around with an STD because the person that they caught it from didn't show any symptoms. So please be very careful with these things, and make sure your patients are as well if you go into the medical field. So here you have another lovely gram-negative bacterial infection that is sexually transmitted, usually causing very painful soft ulcers, so ulcers that we call chancroid or soft canker issues over here. Now this is, chancroid is a little bit different from some of the other sores in that chancroid sores are very, very painful. Like I mentioned, it is gram-negative, so they're able to do smears of the aspirates from that they obtain in the medical office. So they suction out basically particles from this infection. So think of, let's say, if there's discharge or whatnot, or even suctioning out some of the, let's call it the yuck from that sore, and then they culture it and do the gram stain. And if it's, you know, visualized, it'll basically look like gram-negative rods that are in this chain of what they call a school of fish appearance. So I want you to circle gram stain and write school of fish appearance. So if I mention, or if I ask on the exam, which of the following infections is kind of associated with a school of fish appearance, that would be chancroid. Okay. Now again, just like some of the other ones, there are treatments provided that will help with these kinds of symptoms. Sometimes chancroid that we just talked about on the previous slide is mixed up with what's called Donovanosis. And Donovanosis is caused also by a gram-negative rod, but this one is Klebsiella. So whenever you see Klebsiella, I want you to remember that that is what's causing Donovanosis. Okay, so fair game for me to ask. Klebsiella is causing Donovanosis, and this one creates also these crazy nodules on the genital region that then end up kind of breaking down to form these ulcers with a lot of bleeding in them as well. And unfortunately, when you have these kinds of ulcers, anytime you have ulcers in the body, you're then prone to secondary infections. So a lot of times people with Donovanosis have to be very careful of secondary infections. And when you see the word granuloma or granulomatous, basically that tells you that the ulcer has clumps of tissues around that inflamed wound area. Now, just like with some of the other ones, you're able to treat with antibiotics, and the two big ones for treating STDs tend to be doxycycline and azithromycin. Now, all of those examples that we just went through are bacterial, but I do want to give you some of the viral infections as well that are STDs. The first one is one of the most famous, so everybody knows herpes, but there are some things that you may not know about herpes or you may not realize. So first off, when you think of herpes, there are actually two different forms. There's herpes simplex 2 and herpes simplex 1, and it's funny because back in the day, it used to be that herpes simplex 1 was the infection that you found in the mouth region, so mouth sores, whereas herpes simplex 2 was where you found in the genital region. Okay, so think HSV1 mouth, HSV2 genital. Now, funny enough, nowadays, both are associated with both locations. So you find HSV1 and 2 on the mouth and on the genitals. I won't flat out say why that is, but I think you know why that is. Okay. I also do want to note that when it comes to these two, as much as I mentioned, oral sex and all of that, these are not just sexually transmitted. So this is viral infections that are in saliva. So even a lot of children, unfortunately, pick up herpes from relatives because the relatives will share drinks. So for instance, sharing a straw or the cup will then transfer the saliva to the child, or even kissing a child on the mouth the way, relatives sometimes do, just a quick peck on the mouth and not thinking of all of the infections that they have, that are transmittable. So even though we do say these are sexually transmitted, please keep in mind, you can accidentally transmit them to anyone regardless of age and not just through sex. Now, when we talk about herpes, one of the big things students tend to always know is you are stuck with it for life, okay? So unfortunately, herpes ends up going dormant in the nerves and then will reactivate. And because it's going dormant in the nerves, the reactivation can be quite painful, those blisters and whatnot. And like I said before, anything that is latent, when are the two times that they tend to reactivate? One is during stress, one is when you are immunocompromised. Make sure you remember that. And when they come back, it's usually more painful and problematic because they've been now in the nerve cells that they're emerging from. Also keep in mind, like I mentioned earlier, this can be spread without showing symptoms. You can get herpes on your mouth or your genital region from someone who does not even have sores. So please be careful about sexual practices, and also be informing your patients as well, because a lot of patients do not realize these things. What's crazy about genital herpes is that the amount of people that have it is crazy high. Global estimates are more than 75% of the population has it, and most don't even realize it, so they end up spreading it to more people. And estimates are at nearly 800,000 newly infected Americans a year. So please try not to be one of those newly affected, because they are finding that a lot of these infections, especially the viral ones that go latent, do lead to issues down the line, including cancer. So don't take these things lightly. Speaking of cancer is the big bad one that you hear of nowadays, HPV, human papillomavirus. Now, this is what causes things like genital warts, and if you think of warts that uncontrolled, so uncontrolled cellular growth outward, if a virus is able of causing those, then it makes a special sense that it will also be able to cause the uncontrolled cell growth of tumors and cancers. I want you, anytime you think of HPV, to realize that it is now not only the leading cause of cervical cancer, so know that one. It is the leading cause of cervical cancer, but also now the leading cause of rectal cancer and throat cancer. Okay, big time cause of throat cancer. In fact, usually if someone presents with throat cancer, 99.9% of the time, it is usually nowadays HPV causing it. And unfortunately, with these kinds of patients, if they have cancer caused by HPV, let's say you have a female patient who comes to you with cervical cancer, you treat that and you're so happy that she's in remission for the cervical cancer. Unfortunately, a lot of times within 6 months or a year later, pops up throat cancer as well, and it's killing a lot of women. And the really, really sad part about this is a lot of these women, especially who are dying, even though men can as well, a lot of the women who are dying didn't even know that they had an STD, and they didn't realize that they got this because their husband was cheating on them. So it's really sad, the number of stories that you see that these women were in monogamous relationships, doing everything right, faithful, thought that just because they're with one person at this moment, you know, married, safe, secure, they thought that they were fine. They didn't have to worry about, you know, STDs because they think that's for young, you know, partying kids. And it's like, no. Unfortunately, they didn't know that their partner was cheating on them. They picked up this virus, and down the line it caused cancer, and a lot of them end up dying, unfortunately, because the cervical cancer and the throat cancer especially are very aggressive, and the rectal cancer. Even you see a lot of celebrities facing these issues as well. So please be very careful when it comes to HPV. It is skyrocketing, the number of people who have it. And like I said, a lot of them do not show symptoms. So especially the males tend not to show the symptoms as much unless down the line they then get the throat cancer issue from it. Now, there has been a vaccine developed. Initially, they had you do 3 doses of it, so you would go back every few months to get another dose of it. But now they're showing that even just 1 dose alone seems to be enough to prevent getting HPV. And you are able to get it at any age. They used to only give it to younger people because they figured these are the people who have not had sexual encounters yet. But now they're letting even adults get it just to try and help minimize that risk, because if you haven't been exposed to HPV yet, you do want to be protected or more protected from it. And keep in mind, when it comes to HPV, you can only treat the symptoms that you're seeing. So for instance, cryotherapy or drugs to remove the warts, but you will not get rid of the infection because it tends to go latent in the body and then cause the cancer down the line. Some of the other big viral infections that are sexually transmitted include HIV and hepatitis. There are tons of things that we could talk about with HIV, but this is again just general course where I just want to give you a sampling of everything. So for HIV, I want you to know it stands for human immunodeficiency virus and ultimately leads to AIDS, acquired immunodeficiency syndrome. What this means is HIV is the infection, the viral infection that you get. This viral infection, the viruses attack your helper T cells, okay, meaning it's attacking your immune system, greatly reduces the number of white blood cells you have to protect your body, and eventually when your immune system is very low with very few helper T cells, then you become categorized as having AIDS, which is the acquired immunodeficiency syndrome. So the infection is HIV, but when you have the lessened immunity, that is then AIDS. And note that there is still no cure for it. Even though you may hear some things on the news, those are not true official cures yet. There's also hepatitis, which is not just an STD. There are various ways to get hepatitis infections, such as drug use, sharing needles, for instance. But what I want you to know about hepatitis is it's a viral infection that targets the liver, okay? And there are different forms of it, multiple which are sexually transmitted. Now, seeing as I've ruined all kinds of sex for you, why not ruin kissing too? Along the lines of HPV, there is also EBV, which is Epstein-Barr virus. This is the one that most people know as mono, and very common, especially in college students. And a lot of people take it for granted because they're like, oh, you know, it's just kissing disease. Everybody gets it. You know, it's transmitted in the saliva. It's actually an example of a herpes virus, so different from the ones that we just discussed. The fact that it's a herpes virus tells you that it has a DNA genome that we've talked about previously. And when you think about mono, a lot of people think of, again, kissing disease, college campuses, things like that. As you probably know, this is one of the ones that there's no cure, no vaccine. You are stuck with it for life because it is in the herpes family. So any of those herpes viruses like simplex 1 and 2 or like chickenpox, mono, all of those go latent and are stuck with for life. This one particularly tends to cause extreme fatigue, sore throats, a lot of aching and pain and fever. But the crazy and scary thing about EBV is that it can also cause problems down the line. So they are now finding that it tends to cause chronic fatigue syndrome, and more scary is the fact that it has also now been linked to cancers down the line. So you think, oh, you know, it's just mono, just kissing disease, every college student has it, and then boom, down the line, you end up immunodeficient or with cancers, because what EBV does is it goes latent in your B cells. So it's replicating in your B cells and then ends up going latent in a population of the B cells. And so down the line, you could end up immunodeficient and with B cell lymphomas or with nasopharyngeal cancer, because as you know, it tends to focus on your throat region when you end up infected. So even things like kissing, you have to be careful of as well. Don't take these things lightly and never take any infection lightly. Again, you get these things from people who are not even showing symptoms, and then boom, down the line, you have cancer or big time problems like chronic fatigue. Now, before wrapping up, I do want to mention some fungal infections and then parasitic infections, even though you may not be encountering them as much in, you know, let's say the media and whatnot. So the big issue in terms of fungal reproductive or sexually transmitted diseases are vaginitis and urethritis. Specifically, the issue is Candida albicans. So there are different types of yeast. Saccharomyces cerevisiae is the fun one with beer and fermentation and making breads and stuff. Candida albicans is the very pathogenic form of yeast or example of yeast. And what's funny about this yeast causing infections or sexually transmitted diseases is Candida albicans is actually a normal flora in the vagina. And when people think of yeast infections, they of course think of females, because Candida is normally in the vaginal region and certain things can trigger its overgrowth, and they end up with this very itchy, irritating discharge and whatnot. And so females can actually have yeast infections even if they are virgins and not sexually transmitted. Even some women tend to get them, especially around their menstrual cycle. So once a month, even they'll suddenly have some of the irritation if it's not, you know, maybe at its worst. Also things like tighter clothing and warmer summer months can also trigger it, because again, if you think of fungal growth, they like that warmth, moisture kind of condition, and so the vaginal area tends to be a perfect breeding ground for them. But the very interesting part about yeast infections that most people, especially males, do not realize is that yeast infections can be sexually transmitted, and men get them a lot as well. In men, when they get that Candida albicans transferred to their penis, they end up with an infection called balanitis. And balanitis is inflammation or infection of the tip of the penis, which produces major discharge, pain, itching, and dysuria, which is that burning, painful peeing sensation. Okay, so please keep in mind that when you see the term balanitis or when you see Candida albicans, that Candida albicans and yeast infections are not just for women. They can be transmitted to men who then have the inflammation and infection at the tip of their penis called balanitis. And they then, whether it's male or female, end up needing an antifungal drug to help take care of this. And I do want to point out that since it is sexually transmitted, you also end up with the possibility of oral transmission. So again, oral sex can end up creating in the male or the female an overgrowth of yeast in their mouth. And so you can see all of these mouth pictures, tongue and the roof of their mouth and all, even toenail area in this one. But you end up with that overgrowth depending on where the yeast ends up. Okay, so again, infections are not picky about where they're going. So think about this in terms of being careful with your sexual practices and who your partners are. The last traumatizing little thing I want to mention is that parasites can also be sexually transmitted. The parasitic infections are arthropod infestations, so things like Thyrus pubis or Sarcoptes scabiei, which are pubic lice, being, if you've ever heard of crabs, most people have heard of it, or genital scabies, and both of these produce incredible amounts of itching and irritation in the genital region. And again, without getting too visual, one of the interesting things is even with the arthropod infestations, so things like crabs, lice, scabies, any of that can be transmitted to other parts of the body, so even on eyelashes. So again, not getting too visual or graphic, but during sexual practices, you know, it's not just genital to genital encounters that will cause transmission of these different infections. And so these are what these lovely guys look like. You can also, in this case, this is the eyelash infection, where you can see the eggs and the larval infestation, and you see the blistering that they cause. And I want to point out that some of these, especially scabies, you don't end up just with genital infections, but whole body infections are very common with scabies. They're actually hugely common in nursing homes. Again, not going into details, but think about it. These people have a lot of time on their hands, and not just their hands. But anyway, when it comes to these kind of infections, you have to be careful, you know, where you're going, what you're doing, and they are very, very problematic. And then a lot of times lice and scabies, they're treated with things like permethrin shampoo, which then paralyzes and kills the mites and the eggs as well, because it's very important to kill those eggs and get rid of the infections. That is it for today, and I apologize if I scarred or traumatized you for life, but I do hope you keep this lesson in mind throughout all of your life choices in the future. Now, as always, please contact me with any questions that you have, and make sure to add this week's lecture, both parts 1 and 2, to your study guide, and head on over to the discussion board. Thank you, and have a wonderful day.